Hi everyone, welcome back to the channel. Today's question is, why do girls between 10 and 15 years of age get pregnant? This is a very serious medical and social issue in today's world. So we need to look at the biological as well as the societal factors that drive it. Biologically, girls usually enter puberty between ages 9 and 14. It is a process where their reproductive system starts to develop. Menstruation begins and technically their body becomes capable of conceiving. However, at this very young stage, their uterus, pelvic bones, hormonal balance, and overall body maturity are still incomplete. So if pregnancy occurs, the body is not ready to handle the stress of carrying a baby. Medically, this leads to high risks such as obstructed labor, anemia, high blood pressure, miscarriage, premature birth, and even maternal or neonatal death. Hence, teenage pregnancy is one of the leading causes of health complications in developing countries. Now, let's talk about the social and psychological aspects. The reasons why girls between 10 to 15 years become pregnant are many. In some cases, it is due to lack of sexual education. Where children and young teens are unaware about reproductive health, contraception, or the risks of unsafe sexual activity, curiosity combined with peer pressure sometimes pushes them towards experimentation without protection. In many other cases, especially in lower income or vulnerable communities, child marriage is still practiced. It forces young girls into sexual relations and pregnancy before their bodies and minds are ready. It's both a violation of human rights and a major public health concern. Another tragic and unfortunately common factor is sexual abuse and exploitation. Young girls become pregnant against their will due to rape, coercion, or trafficking. They often face physical trauma and long-term emotional scars. In urban settings, factors like media exposure, lack of parental guidance, and absence of open conversation about puberty and safe practices can lead to risky behavior. While in rural settings, ignorance, cultural silence around sex education, gender inequality, and poverty worsen the problem. From the medical perspective, pregnancy at such an early age interferes with the normal growth and development of the girl. Her body is not nutritionally equipped to support a pregnancy. The nutrients are diverted toward the fetus, leading to malnutrition, stunted growth, weak bones, and increased risk of complications like eclampsia and postpartum hemorrhage. The baby, too, is often born underweight, premature, or with developmental issues. Teenage mothers are also more likely to drop out of school, face social stigma, suffer from depression, and have fewer opportunities in life, continuing the cycle of poverty and poor health. Now, let's see what we can do about this issue. Globally, organizations like WHO, UNICEF, and UNFPA highlight that preventing early teenage pregnancy requires a multi-pronged approach. So, comprehensive sexual and reproductive health education in schools. Yes, children as young as 10 years old can benefit from an age-appropriate information about puberty. Consent, contraception, and personal safety. And 2. Easy access to contraception. It's crucial to ensure that young people have access to affordable, safe, and effective contraception methods. No. 3. Strong laws against child marriage and sexual abuse. Governments must enforce laws that protect girls from child marriage and create special courts to deal with cases of sexual abuse. No. 4. Empowering girls through education and economic opportunities. By educating girls and providing them with skills for decent work, we can delay the onset of puberty, reduce the likelihood of teenage pregnancy, and empower them to make informed decisions about their bodies. Number 5. Encouraging parents and communities to talk openly about puberty, consent, and protection. Breaking the silence around sex and relationships can help young people make better choices. Parents, teachers, healthcare providers, and community leaders all have a role to play. Doctors also emphasize that pregnancy before the age of 18 carries significantly higher risk of maternal mortality, which means death of the mother during pregnancy or childbirth. So delaying the first pregnancy until adulthood not only protects the health of the girl, but also improves the survival and development outcomes for the baby. Medically speaking, counseling and antenatal care become extremely important if a young girl does become pregnant. But prevention is always the best solution. Early pregnancies can leave irreversible impacts on a girl's physical and mental health. When society normalizes silence around reproductive issues, girls are left vulnerable. But when awareness spreads, parents, teachers, healthcare providers, and governments can work together to protect them. In conclusion, the reason why girls aged 10 to 15 get pregnant is a combination of early biological fertility, lack of awareness, unsafe or forced sexual activity, child marriage, abuse, and social neglect. The medical consequences are severe, ranging from life-threatening complications to long-term damage to both the mother and the child. The solution lies in education, empowerment, legal protection, and universal access to healthcare. Every child has the right to grow up healthy and safe before taking on the responsibilities of motherhood. Thank you for watching. If you find our videos helpful, please share them with your friends and family. Until next time, stay healthy, stay informed.